The following segment is sponsored by Fairbanks Plastic Surgery. Dr. Fairbanks is back to dive into a transformative surgery that balances form and function. Welcome to the show, Doctor.
Thank you.
All right, let's just dive in right now. What is a rhinoplasty, or some people call it a nose job?
Correct. It addresses both the aesthetic and the function of the nose. Often people will have a nose that they grew up with that they didn't like, or they had a broken nose because of playing soccer or something like that.
My husband actually had a nose job earlier in his, and he had more of like the bulb. Where is that more cosmetic, or is that more the inside function?
That would be more of the cosmetic part of it all. Just the same, I address both inside and outside. So the goal is to make a nose that looks good but breathes well.
Absolutely. That's a very important function, to make sure we can breathe. Are there some other terms, names for it?
No, typically rhinoplasty, nose job. Some will call it a septorhinoplasty, but that's about it.
Well, how does this surgery impact both the form and the function of the nose?
Well, you know, we say that the function actually does follow the form. So if you can make a nose that is more anatomically correct, it actually breathes well. It functions better.
Well, talk about the aesthetics. What are some of the most common aesthetic concerns with someone's nose?
Often it's the dorsal hump in this area. Sometimes it's the tip being too bulbous or round or squared. Those are the main concerns. With regards to those who've had injuries, it's that they have a crooked nose.
So, and is that also the same as a deviated septum, or talk about kind of some other medical issues like those?
Well, the septum is the portion of the nose that divides the two nostrils, the two sides. And that septum will deviate after an injury. And once you straighten the septum, the airflow is much better, more efficient, less snoring, better sleep. It's an all-around game changer for a lot of these people.
Well, and technology continues to change every single day. So what are some of how are these advances really helping a rhinoplasty?
Well, what's interesting is much of what I do is just good old standard plastic surgery. It's following the principles of anatomic proportions and everything. So it's more that we have the ability to do this safely with good anesthesia. We have good instruments, and it really comes down to attention to detail.
No, I think there's a lot, and you're answering so many great questions that people at home have maybe thought, should I do this? So talk to me kind of about, if someone has a deviated septum, can you fix that along with a cosmetic all-in-one, or do you do multiple surgeries?
I do them both, because I will often use the septum to help me with the cosmetic, so that we can reconstruct the nose so that it doesn't drop down to look like a parrot's beak.
Well, thank you so much for taking the time to kind of walk us through that, and I hope that it's helped answer some questions. If someone is ready to move forward with this, where can everyone go for more information to book that appointment with you?
You can go to fairbanksmd.com. All the information is there.
All right. Well, thank you so much, Dr. Fairbanks. Appreciate you coming in.
Thank you.